to the Fracture Prevention Central webinar, Introduction to the NOF NBHA Qualified Clinical Data Registry, the Basics. Fracture Prevention Central, brought to you by the National Bone Health Alliance, is made possible through support from Amgen Inc. and Eli Lilly and Company Incorporated. And now I'll introduce you to Debbie Zaldow, Senior Director, Clinical Programs for the National Bone Health Alliance. Debbie, it's all yours.
Great, thank you. And thank you all for joining us today for our Fracture Prevention Central webinar on the NOF NBHA Qualified Clinical Data Registry. As many of you know, the National Bone Health Alliance was launched in late 2010 as a public-private partnership that brings together the expertise and resources of its public, private, and nonprofit sector partners. NBHA provides a platform for all of our partner groups to address issues important to bone health. We currently have 55 organizational participants that include 35 nonprofit members, 16 private sector members, and 4 government agency liaisons, which provides a collective reach of over 100,000 healthcare professionals and 10 million consumers. NBHA's vision is to improve the overall health and quality of life of all Americans by enhancing their bone health with a focus on addressing the priorities of the Bone Health Summit National Action Plan, which are to promote bone health and prevent disease, improve diagnosis and treatment, and enhance research, surveillance, and evaluation. The Fracture Prevention Central website was launched in March 2013 to help healthcare professionals and administrators implement a coordinator-based post-fracture FLS model of care to reduce secondary fractures and the associated costs while increasing patient outcomes. Currently, we have over 2,300 registrants to the site. Fracture Prevention Central hosts materials from a number of successful domestic and international post-fracture care programs that you can use and adopt for your work. In addition, the site highlights the work of leading FLS programs, including the American Orthopedic Association Own the Bone Program, Kaiser Permanente, and Geisinger Health System. We are currently updating the site to make it easier to navigate and find the hundreds of materials and other resources on the site, including the webinars. We currently have 9 webinars on the Fracture Prevention Central website for on-demand viewing. You can see the list on your screen. There will be 10 next week when we post today's webinar on the site. Now I'd like to introduce our speaker, Jessica Safko, Manager, Provider Products, CE City. Ms. Safko currently serves in the role of Manager of Provider Products at CE City. In her role, Ms. Safko manages the product lifecycle for the company's quality reporting solutions, including the Physician Quality Reporting System. Jessica?
Hello, everyone, and thank you for joining us today. I'm Jessica Safko, CE City's Manager of Provider Products, and today we will review the NOF NBHA Quality Improvement Registry. Today we will cover the NOF NBHA Quality Improvement Registry. We will do a brief walkthrough through the registry and review the benefits of registry participation. At the conclusion of today's webcast, we will have a question and answer session. If you would like to ask a question, please click the question section on the webinar menu. What is the NOF NBHA Quality Improvement Registry? The NOF and NBHA Quality Improvement Registry, in collaboration with CE City, is intended for all providers and specialties caring for patients with osteoporosis. The registry will provide participating providers with timely custom continuous performance monitors, performance gap analysis and patient outlier identification, access to improvement interventions to close performance gaps, including patient care management tools, targeted education resources, and other evidence-based interventions, along with comparison versus registry benchmarks and peer-to-peer comparison. Now we will walk through the registry. The measures available for reporting are displayed on this screen. Please visit the registry for additional details and reporting requirements for these registry measures. The NOF and NBHA Quality Improvement Registry allows several methods for data entry, including manual data entry through online forms, data upload tools for loading files directly into the product, and custom data integration services from CE City's expert data management and integration team. The NOF and NBHA Quality Improvement Registry provides a longitudinal view of the measure scores for your practice to allow you to continuously measure and monitor quality measure scores. Manage your data around a core set of both PQRS and non-PQRS measures through the NOF and NBHA Quality Improvement Registry. Pictured on the screen here is the dashboard, which includes each measure being tracked, performance trend lines, quality measure scores, and measure gaps. The NOF and NBHA Quality Improvement Registry Analytics equips you with the tools necessary to measure performance and make quality improvements to potentially increase your scores prior to submitting your final measure scores. The NOF and NBHA Quality Improvement Registry provides analytics at the provider level. Pictured on this screen is the provider level dashboard, which includes each measure being tracked, performance score trend lines, quality measure scores, measure gaps, with national benchmarks where available, as well as a list of patient outliers. Once a measure gap is identified, the NOF and NBHA Quality Improvement Registry automatically identifies improvement interventions. The green How Do I Improve button associated with each measure links to relevant improvement tools, including relevant clinical guidelines and continuing education materials. In addition to the performance management and quality improvement tools, in the registry you can also receive additional benefits and recognition through your participation, such as the Physician Quality Reporting System, maintenance of certification, and Meaningful Use Stage 2 specialized registry reporting. You can use your registry data for PQRS reporting. This qualified clinical data registry qualifies as a CMS-approved reporting tool for PQRS reporting. The custom measure set available through the NOF and NBHA Quality Improvement Registry is designed specifically for practitioners providing care for patients with osteoporosis. To qualify for PQRS through the NOF NBHA Quality Improvement Registry, an eligible provider would complete PQRS registration within the NOF and NBHA Quality Improvement Registry. Then, select at least 9 measures for your PQRS reporting, with 50% of your applicable patients being reported over 3 national quality strategy domains with at least 1 outcome measure. A provider must also complete an attestation module for submission to CMS. Successful enrollment and submission of data to the NOF and NBHA Quality Improvement Registry for the purpose of satisfying the MU2 Menu Measure Number 6 for specialized registry reporting is contingent upon the submission of data directly from a CEHRT EHR to the registry. Providers who would like to achieve the MU2 Menu Measure Number 6 will need to connect their EHR directly to the NOF and NBHA Quality Improvement Registry. EHRs interested in submitting data to the NOF and NBHA Quality Improvement Registry should contact CE City for additional details. Maintenance of certification acknowledges the growth and complexity of medical science, clinical care, and the importance of the physician's relationship with the patient in delivering quality clinical outcomes. It also requires proof that a physician has the practice-related knowledge to provide quality care in a particular specialty. The NOF and NBHA Quality Improvement Registry offers participating physicians the ability to reuse their registry data in the form of board-ready reports for self-directed PIMs for MOC. The ABIM self-directed PIM will grant Part 4 MOC credit to physicians who complete the ABIM Self-Directed Practice Improvement Module. To see additional information about MOC certification through the registry, please review the registry details. value-based payment, and the NOF NBHA Quality Improvement Registry. The NOF NBHA Quality Improvement Registry can assist eligible providers in avoiding the maximum penalty and achieving the maximum incentive under the PQRS and value-based modifier programs. These programs collectively place approximately 2.5% to 6.5% of eligible providers' Medicare payments at risk. PQRS carries an automatic 2% penalty for non-participation and a 0.5% bonus for those who successfully report PQRS measures. 2014 is actually the last year where there are incentives available for PQRS reporting. The value-based modifier applies to providers who are part of a tax ID with 10 or more providers and carries an automatic additive 2% penalty for non-participation in the PQRS program. The value-based modifier also carries up to a 2% incentive for practices of 10 to 99 providers based on a cost-quality ratio. For practices of 100 or more, there is a -2% to +2% payment adjustment in a penalty or bonus based on a cost-quality ratio. Proposed for 2015 is a potential 6% Medicare reimbursement risk for groups of 1 to 9 providers and a 10% risk for groups of 10 or more providers. If you would like to ask a question about today's presentation, please submit it through the question feature on the webinar menu.
All right. Thank you very much, Jessica. And as you said, we're now ready for questions. To ask a question via the web presentation, select the chat pod located in the lower left corner of your screen, then type and send your question. Once again, to ask a question via the web presentation, select the chat pod located in the lower left corner of your screen, then type and send your question. I'll now turn it back to our speakers for questions. Okay. Looks like we do have some questions coming in. One moment.
Give it a second.
Okay.
So I guess I can start actually because I see a couple questions around how this is complementary with Own the Bone. So Own the Bone is a American Orthopedic Association program that allows folks to, get their FLS set up, track a number of measures. I would say this is complementary to that, and actually, as was described, folks would have the ability to upload their registry information either from Own the Bone, from an electronic medical record, into the system to be able to get those credits, the PQRS credits, as well as, not be subject to the value-based modifier. So I would say that this is definitely complementary to those efforts. Just wanted to make that clear.
Okay. So our next question. All right, our next question is, how do we find out which EHR systems are compatible with direct interaction with NOF? And any of our presenters can answer that.
Yeah, thank you. To get a list of EHRs that are compatible with the registry, please contact NOF and CE City.
Okay, thank you. Our next question, when does all data need to be entered by? December 2014?
Jessica, do you want to take that one?
Yeah.
The deadline at this time to complete data submission for programs such as PQRS will be the end of February of 2015.
Okay, great. Thank you. Is there a cost associated with using the registry?
There is a cost associated with using the registry. There is a range from $4.99 to $6.99, and that depends on whether you are an NOF member, a member of an NOF member, or freestanding. And we're happy to answer any other detailed questions on pricing as well if you want to email us.
Yeah, and to be clear, that's for healthcare professional. So as Debbie said, $4.99 if you're an NOF member, $5.99 if you're a member of one of the NBHA partner societies. So that, most of the major specialty societies are members of NBHA. So if you're a member of ASBMR, ISCD, AOA, AAOS, et cetera, you would get that $5.99 rate. And then $6.99 would be someone that's not affiliated with any of the organizations around the table.
Okay, thank you. Our next question. Do you need an HL7 to connect directly to our software program?
Jessica, can you take that one?
Yeah, sure. So the specifications for the registry can be derived by contacting us, and so we'll be happy to share the registry specs with you if you're interested in understanding what data elements are necessary.
Great. And then the next one I see, what data is needed if you don't have an EHR? Manually enter data. So Jessica, can you take that one as well?
Yes. As I mentioned earlier in the presentation, there are two different ways that you can enter data into the system. You can enter data into a chart review form, which would be much like a questionnaire where questions would be asked directly related to the measures, and you would simply need to answer the questions based on the patient's encounter. There's also a way to upload that data. You can upload that data by completing a spreadsheet that can be either exported out of an already existing system, but if you don't have an electronic system, you can also add data to that spreadsheet and upload it into the registry as well. Thank you.
Great. Let me see. I don't see any other questions, but thought maybe it would be helpful, I don't know if Jessica, you could just take folks through, because I know it's a little complex, that kind of what we call the carrots and sticks in terms of the percent of revenue at risk, and I don't know if maybe you can convert what that means to an average practitioner in terms of the amount of money that you might be at risk if you don't do this. I don't know if you can go through that with folks a little bit, because I know it's an important concept, obviously.
Absolutely. So in 2014, there are two programs that come into play for a provider or for an institution. The first is the Physician Quality Reporting System, and within the Physician Quality Reporting System, there is a 2% penalty for any provider who does not report, and that 2% is taken off of their allowed Medicare charges in 2016. So there's a 2-year difference between when you must report PQRS versus when the penalties will actually be realized. Conversely, if you participate in PQRS and you meet the criteria for the incentive payment, you could be eligible to receive a 0.5% incentive payment, again, based on your 2014 allowed Medicare charges. The value-based modifier program is the second program that comes into play in 2014, and the value-based modifier really depends on the size of the providers in the tax ID. So the number of providers in the tax ID will determine whether or not your practice is eligible for this value-based modifier program. Practices of 1 to 9 NPIs affiliated with a tax ID are not eligible for the value-based modifier program in 2014. Practices with 10 to 99 NPIs affiliated with the tax ID are eligible for the value-based modifier program. What that means for practices of 10 to 99 is that if you do not report PQRS at all this year, not only will you receive a 2% PQRS penalty, but CMS will also assess an additive 2% PQRS penalty under the value-based modifier program. However, if you do report PQRS, then you will avoid that value-based modifier penalty, and you could also become eligible for anywhere between a 0 to 2% positive payment adjustment based on a combined cost and quality score. The third tier of practice sizes for the value-based modifier are those in tax IDs that have 100 or more NPIs affiliated with the tax ID. Again, if you're in a tax ID of 100 or more NPIs and you don't report PQRS, you will receive the 2% PQRS penalty, the additional 2% VBM penalty. However, what's different is that for practices of 100 or more, if you do report PQRS, you are then added into the value-based modifier quality tiering scale, and you could receive anywhere between a negative 2% payment adjustment up to a positive 2% payment adjustment based on your combined cost and quality scores. And so for practices of 100 or more, even if you're reporting PQRS, you're still eligible for potential negative payment adjustments under the value-based modifier, and that will be, again, be based on your cost and quality combined scores.
I do see that we received just one more question here at the end, asking if you enter 50% of just your osteoporosis patients only. And you would actually need to, after you select which measures you'd like to report on, and I'm assuming that this question is in relation to PQRS reporting, you would look at the measures that you are actually going to submit on and then report 50% of your applicable patients for those measures. You would be able to review all of the available measures from the registry as well as their reporting requirements. So I would advise to visit the registry and take a look at the measures that are available there. You would then plan on reporting 50% of the applicable patients for the measures that you'd like to choose to report.
Gotcha. Great. Let's see. Any other questions that have come through the transom? Let's look here real quick. Debbie, any other comments? I mean, you know, we're very excited about this new mechanism to help folks move forward in quality, especially because to me this is the year that the carrots and sticks we've been talking about are really carrots in a bat in terms of the amount of revenue at risk moving forward. And as Jessica said, you know, into 2015, it's merely a proposal now, but anticipated that the revenue at risk will be even greater. And, you know, to think that if you don't participate in PQRS this year, that is going to result in 2015 in that value-based modifier reduction of 1, 2, 3%. So that's, you know, basically all of your Medicare reimbursements are going to be taken off the top. So this is really the year to figure this out and to hopefully participate in something like this osteoporosis registry. And I guess the other thing to say is that, you know, this registry isn't just a Fracture Liaison Service registry. Obviously, we're sponsoring this through Fracture Prevention Central related to our FLS work. But this really is, you know, a registry that applies to anyone seeing patients with osteoporosis or low bone mass. And, you know, on the registry site, you can see the list of the 14 measures that we've laid out, 6 PQRS measures, 8 non-PQRS measures. So there are measures like the HEDIS post-fracture measure that we talk about in terms of the 80% care gap, you know, within 6 months, folks getting screened and or treated. Those 2 measures are there. Even the 3 Joint Commission measures that are now, 2 of them have been endorsed by the National Quality Forum, and we anticipate the Joint Commission going back next year and determining whether to create a new core measure set around those measures as early as next year. So there is a number of AMA PCPI measures as well. So really all the major measures I think that we collectively talk about in osteoporosis are there. So I think this gives you a nice mechanism in a very automated way, as Jessica has described, to participate and to think that an investment of $400 or $500, $600 per healthcare professional to get value that may be in the thousands of dollars, depending on the amount of Medicare billing each individual healthcare professional is doing. I guess the other thing, just to clear up too, just so it's clear, is that, you know, this doesn't just apply to MDs, but to MPs, PAs, anyone with that tax ID number, essentially that's a, you know, practicing provider. So it really does relate to the entire field, and you know, not just the docs. So any other questions, or maybe Debbie, I don't know if you or Jessica have any closing remarks.
Yeah, well, I saw that we were getting some feedback regarding choosing applicable patients, not only the 50% patients, but just how to choose them. And I know Jessica talked a little bit about looking at the measures first. So I was hoping she could clarify that piece a bit. And then the only other comment that I wanted to make is that, with the QCDR, obviously all the data is all HIPAA compliant, and that really ties in and is with a really easy-to-use piece. So I don't know if, Jessica, if you could talk a little bit about the applicable patients.
Sure. Again, the patients that you want to choose are going to be patients around the measures that you will be reporting on. So I'd like to, again, stress how important it is to go to the registry and take a look at those posted measures, as each of the posted measures are going to give more information about exactly the kind of patients that you're going to choose to report on, and that's how you will then define what 50% of that patient population looks like, because each measure may be slightly different from one to the next.
And in order to access that measure information, please visit www.medconcert.com/fracture QIR, FRACTUREQIR.
All right, I think that's the last of the questions that we see, but from the NBHA perspective, Debbie Zeldo is your direct contact, so anyone that wants to reach out with additional questions, and certainly questions, more technical questions from the CE City perspective, Debbie can definitely triage those. So she's available at debbie.zeldow, DEBBIE.ZELDOW @nbha.org.
Okay, great. Thank you very much, and we'd like to thank our audience for joining us, and I'd like to also thank our speakers. Please take a moment to fill out the evaluation that will be on your screen shortly. This webinar will be available on demand on the Fracture Prevention Central website in approximately 1 week. Again, thank you, and have a great day.